Hello, I'm Louisa Baldini, and I am delighted to be moderating this discussion on the pathway to localization, the importance of building health capacity in developing countries. And this is a discussion in partnership with the Qatar charity. As local as possible, as international as necessary. That was the vision the UN Secretary General declared for humanitarian action in 2016 at the World Humanitarian Summit. 4 years on, the localization agenda is more relevant than ever. There is an urgent need to recognise and support local communities in being the decision makers and the leaders of solutions which impact their healthcare systems. We'll be hearing from 4 experts in the field. You can see they are ready and waiting. We will be discussing the common challenges localised health capacity faces in developing countries, current good practices, any innovative approaches and opportunities to link national healthcare strategies with broader global localization frameworks. So let me introduce our panel of experts today. They are Dr. Robert Walters, who is chairman of Orbis, a global charity bringing people together to fight avoidable blindness. Hello, Dr. Walters. We have Ishrat Ullah, Head of Relief at the Qatar charity. We have Mohammed Ahmad, Chair of the Humanitarian Network Pakistan, a network of NGOs in Pakistan. He's joining us from Peshawar. And we have Bashaya Al-Ali, International Programs Director at the Qatar Fund for Development, an NGO committed on behalf of the state of Qatar to improving the livelihood of communities around the world. Thank you all so much for joining us. So I wanted to kick off with a question for all of you, and that is, we know improving healthcare systems takes time and there are many areas that need to be considered. But what would you say is the biggest challenge to improving localized health systems in the regions you work? And if we could start, please, with Mr. Ahmad.
Thank you. First of all, thanks for inviting us to speak on this panel. The shortest answer is prioritization and then resource allocation. Most of the third world countries, the region we are in, are under debt servicing. So if you analyze the annual budget of these countries, so the social services portfolio is quite low as compared to the debt servicing. This is one issue. The second issue is for the available budget prioritization. Most of the budget to the health system is going for the metropolitan cities and big hospitals and tertiary care, while we are neglecting secondary and primary health. And that's why in any emergency situation, our primary health care are our basic health units. They are less equipped, not only with the doctor, but with the equipment and medicine. And there's a huge rush on the metropolitan cities, and they sometimes disrupt the whole health system, and we have seen it in the COVID situation. So my answer will be resources and then prioritization of social services and primary, especially primary and secondary health at rural and urban setting. Thank you.
Thank you very much. And what about for you, Bashaya Al-Ali? What is the biggest challenge?
For us, I believe translating local needs and drawing references to international frameworks has definitely been a challenge, especially in face of sometimes lack of local capacity. So what our approach has been in the past, considering that we are a young development actor in the field, we are very fortunate to be able to adapt and be very agile. So our focus has been varying from, so our focus has been kind of shifting towards building resilience and identifying gaps in structures and existing systems, and then using that to communicate with the local authorities or the local communities to translate the needs of the local population and address those most urgent services.
So really trying to focus on those local populations. Okay, thank you so much. And Mr. Ulla, what about for you in the areas you're dealing with?
Thank you, Louisa, for giving me this opportunity. For us, in my opinion, is Brother Ahmad and Bashir. They rightly pointed out, the major or the biggest challenge because for organizations like us, we usually work in underdeveloped or developing countries, usually responding to emergencies and humanitarian situations. The biggest challenge is weak or poor health infrastructure, especially in the rural areas. When there is any disaster, so the already existing infrastructure is very poor and very poor quality. So this is a biggest challenge for the other challenge. I would like to say that the health guidelines and policies in those countries are usually it's like not actively it's not very active. So for organizations like us, we should most focus on local communities to build their capacities, because in any emergency response, they are the first responders in any disasters. So we should more focus on building the local communities capacities, and also the capacity of the local health system, especially at rural in the rural areas, so that in the future, if there is any disasters strike or happens, they respond properly.
Thank you. Thank you. And Dr. Walters, you at Orbis are not so much dealing with those emergency situations, but you are really trying to improve healthcare in those local areas, but you're dealing internationally, aren't you?
Very much so, Louisa. Thank you very much for inviting me to join this panel. This is a common problem, and it's been touched on by most people today, and that is that Orbis, for example, is an international eye charity dedicated to the treatment and prevention of blindness in the developing world. But the problems are common amongst most of us who work in these situations. And the first thing is that, as has been mentioned, the healthcare systems in place in many developing countries are very poorly funded, and that is counterbalanced adversely by the fact that the amount of disease in those countries is normally disproportionately high. So you're having a double hit here. And I think from our point of view, we find that the most important thing to do is to work very carefully with the governments, and of course to advocate for your cause and also to advocate for good health systems. But you need to work carefully with the governments at a high level and also with your partners. The power of partnership is very important. Also, the other thing that's been mentioned is the concept of the urban-rural disparity, and that's very common in the countries where we work. So I think those are the main points. Thank you.
So when it comes to Orbis, you literally, well, not you yourself, although I think you have done, you've been working with them now since 1994, I believe, but there is an aircraft that literally flies in to help give treatment that will save people's eyesight. But it's not a case of flying in and flying out. You're doing much more than that down on the ground, aren't you, to try and improve the localized health services? Can you tell us a bit about that, please?
Yes, very much so. I've got a picture of the aircraft here. I'm going to show it to you, so that's a bit of fun for you. Can you see it there? Yes, there we are. So no, the aircraft is, a great icon for Orbis and is a very important part of the work we do. But it's very important for teaching systems. It's internationally recognized eye hospital. but it only really touches the surface. It begins to that introduction into countries that we require, and but we are a capacity building organization, and so we also have in-country programs which are not involved with the plane necessarily, but can be adjunctive to the plane. But it is important if you're developing capacity, especially in training, because we are trying to train the local healthcare systems to be able to look after their own. It's wonderful if we can actually leave those countries and they can do it themselves. But it is about building capacity over a long, long period of time. And Orbis is not in many, many countries. We're in about between 15, 20, 25 countries, depending which time of the cycle we're in. But we want to be in a small number of countries for a long period of time. You need to invest in those countries over a long period of time.
And have you seen a shift in localization since Orbis has started working in those countries? How has the work evolved?
Undoubtedly, it's a really good question. Yes, many of the countries, when we started working with Orbis in 1982, during those almost 40 years, we have seen some countries grow really positively in terms of their capacity, particularly some of the Asian countries. So, you know, India, Bangladesh, Pakistan to an extent, and China, Vietnam. They've all grown enormously partly as their economy has expanded and they've become emerging nations, but also we've seen that the work we have put in to train people, to support those people in their training, and also to support them so they won't leave those countries and go to richer countries, so they will support their own communities. That has really paid dividends.
Talking about training, teaching, and Mr. Ahmad in Pakistan, with your network of, I think, over 170 NGOs, how can you ensure that everybody can get the training they need to cover such a wide geographical area as well, and some areas that must be very difficult to reach?
Thank you. I think there is like a misperception or a lack of understanding about the health services and health system. Health system is much more than the health services. It includes nutrition, it includes hygiene condition, and it includes the community behaviors as well. What our organizations are doing right now, we basically prioritize, we have a national plan how to strengthen our health system and how to include community and how to include private sector and be partnered with private sector in some areas. So we prioritize that we need to go for the vulnerable geographical areas, and whatever we are getting from the outside funding, we are prioritizing those areas whereby the government is like less investing, or the private sector is not investing because of the poverty ratio over there. Because the private sector, they have their own priorities. So our organization, we are supporting the government, the public health system, while we are educating community on health hygiene and nutrition, and we are working with them how to develop a partnership between the community and government, and how to take care of the health facility jointly as a team. So what our organization, we are not only equipping the duty bearer, strengthening them with the support of WHO, ensuring the global standard, but we are doing awareness raising and engaging community in all these practices so that they own the health system and they can run it themselves. Thank you.
And that community involvement, I know, is incredibly important for what you're doing, and we will come back to that. But you mentioned funding and investment, so I just wanted to ask Bashaya Al-Ali from the Qatar Fund for Development. The fund has the ability to provide the resources for programs in many different countries, tackling many different health concerns. How do you see your role in the transformation of healthcare systems? Because even with what we've experienced this year, healthcare systems need to keep evolving, don't they, if they're going to be able to really help the communities that need that help?
Yes. So in the Qatar Fund, we see our role as a catalyst or as a catalyzer to bring about sustainable development that does not just meet the needs of the most vulnerable, but would continue to support, uplift, and also continue to help people prosper. And we see this achieved only through a full spectrum or a nexus approach is adopted in all of our initiatives. What this means is that as the Qatar Fund and other donors and implementers are also encouraged to do the same, we must implement, adopt, or put in place mechanisms that ensure our collective investments in these systems are, first of all, they are contextual. That means local solutions for local needs, where we account for country and regional level priorities. This is important to ensure that any gaps in the system are met and that any needs by the community are also met, and that there is no oversaturation of resources in any specific field. The second thing is that we need to ensure that our investments in these systems are sustainable. By that, we mean they have to be sustainable on the programmatic, on the financial, and on the environmental level. Programmatic through training, through investing in local capacity building, knowledge transfer and dissemination are both key priorities for the fund and the core value in this organization. Financial sustainability, we need to look for more innovative funding mechanisms that go beyond simple grants and loans and look at
Oh dear, we seem to have lost Bashaya just for a moment. As you can appreciate, this is quite a feat of technology, bringing everyone together. Oh, I think we have her back now. Sorry, we lost you momentarily, those pesky technicals. But you were talking about the need for more innovative ideas of raising funding, for example, and providing funding.
Yeah, so just to continue on our sustainability, when we talk about financial sustainability, innovative financing is something that we continue to look at. And the third one is environmental sustainability. So climate change is a real and it is a present threat and a danger. So if there are no policies and the most affected or the most vulnerable are always the most affected, the worst affected. So what we need to do is we ensure environmental sustainability as well. The third attribute that we look for in our investment in these systems is relevance, and relevance to international frameworks and global agendas. So yes, we account for the localization because localization is extremely important. We need to ensure that our interventions contribute, meet the local needs, but are also examined in relation to current priorities. That is important because it means that all of our resources can be mobilized together and they could be pulled together and we can work towards our fourth attribute when we try and invest in the system, which is collaboration. Collaboration is a core value in our fund, So in our local and international partner organizations, we work within a certain set of priorities, and those are guided by local and global strategies. So we seek partners like Qatar Charity, for example, is one of our implementing partners. We work with Orbis through the Qatar Creating Vision Initiative, the Global Fund, and Gavi. Those are some of the organizations that we partner with. And we try and identify synergies and mutual interests to help us achieve a common goal. So by working together, we try and implement and integrate and align our solutions with the government authorities and local communities at all levels. So just kind of to sum it up, what we do is to transform systems is we invest in ensuring that our investments are contextual, sustainable, relevant, and collaborative to make sure that they are resilient. Thank you.
Thank you, Bashir. A lot of really useful information there. And you mentioned towards the end of your answer there, collaboration. And to that point, Ishratullah, for the Qatar charity, I wanted to ask, as both a funder and an implementer, how do you see your role in terms of collaboration and localization and how you design the programs?
It's a good question, Louisa. In terms of collaboration and localization, we, Qatar Charity, when we go to any country or when we start our operations in any country, the first thing we think about the exit strategy, because we need to, as I mentioned before, that our role is only to fill in the gaps, but definitely will not stay there forever. So what we do, we try to build the capacities of the local community organizations. We work with the government as part of their national plan. So we don't develop a parallel system, but we work within the systems. We collaborate with the government. We collaborate with other stakeholders like international NGOs, with the local communities. So by this, we our investment is safe. For example, all our interventions are sustainable, and it's the impact is visible because we are working through a system by supporting the local government, by supporting the local community organization, and working in close coordination with all the international organizations, with local organizations, with international NGOs as well.
Thank you for that. And I wanted to go back, Mohammed, to you to ask about Pakistan. You must have an effective oversight of all the different communities, or some of them, probably not all of them, that the humanitarian network is trying to help. Do those communities manage to play a large role in the development of programs and their success? Or are they very reliant on what is on offer?
Thank you. We as NHN, we are advocate of accountable humanitarian action, top down. So we are making ourselves accountable to the community, and we are trying to hold our government accountable for our community. And for that reason, it is including community engagement is included in our program design, in need assessment, and then program designing, and they are part and parcel of the implementation as well, because at the end of the day, we need them to have ownership of our program for a sustainable manner. So yes, they are playing a very, very important role, because they know what they need, and they know how to fulfill those needs, and how to carry that forward. So as said, we are playing the role of catalyst. We are just strengthening them, we are empowering them, and giving them enabling environment and connections with the government. So this is our job. We are their voice, and we are involving them, and they are actively participating to a larger extent.
Thank you. And I also wanted to ask about the integration with local authorities and how important that is when choosing which programs to support when it comes to the Qatar Fund for Development. Bashir Al-Ali, do you have any information on that? Any thoughts on that, please?
Certainly. The integration is extremely important to us. So we support a progressive universalism where the hardest to reach and most vulnerable populations are given the utmost priority. We follow a strictly strict principle of do no harm, in which activities that have the potential to contribute to strengthening health systems, but do not undermine them. So the better integration we have with local authorities and systems and existing structures, then the larger and more sustainable the impact is. So sustainability and resilience to us can only be achieved by investing in local capacities, whether on the government or the non-government level. We are driven by a philosophy of cooperation, and as such, health activities are integrated with the national systems to avoid fragmentation and duplication.
Thank you so much. Now, of course, all your hard work and efforts have been challenged this year by COVID. What sort of impact has that had on the work that you are doing? And I wanted to ask you actually, Dr. Walters, how Orbis has adapted and how much you've needed to innovate as a result, and has that even been possible in such a difficult year?
Yes, thank you. I mean, it has been a difficult year for everybody. Just let me touch on a previous point, which I agree very much with my co-presenters about the concept and the importance of partnership and collaboration. It really is important. You can't do everything on your own, and you need to work very carefully with all those key partners, the other NGOs, the funders, the governments, in order to achieve things, and particularly to make sure there's no duplication. So that is a very important point. Yes, COVID has impacted everybody, and it's very much on everybody's mind at the moment. Orbis has been able to adapt. We're very fortunate in that in 2003, we launched and developed an online teaching system, which is called CyberSite, and that has been invaluable during this difficult year. So those countries where we haven't been able to work, we've been able to continue our work of capacity building by doing this remotely through CyberSite. And that was a platform that was already in existence and has grown enormously during the last year. So that's been very helpful. And secondly, we've put in systems in place to support countries that don't have personal protective equipment, for example, that aren't able to carry on our programs because of lack of systems such as that. And so we have put a lot of money behind those systems in order to allow for those local healthcare interventions to still take place. An example of that is in Ethiopia, where we've done a lot of work for almost 30 years now. And we work particularly in trachoma. And every year there is what we call a mass drug administration of azithromycin amongst the population. And this year we'll be treating about 10 million people. And in order, that's been on hold, but it's going to start again at the end of this month with the support and additional finance from Orbis.
Good to hear. But has the plane actually been grounded? Is it going to be able to depart again soon then?
The plane itself is grounded, but it's not. It's working on the ground, so to speak. So we're having teaching sessions from within the plane, because the plane is able to coordinate globally. And so, for example, we have webinars, we have examples of surgery that we've been carried out previously on the plane, and we can still continue teaching from that library. So we are putting together plane-based programs, albeit the plane is not actually in the country concerned. But that's the power of current forms of communication, isn't it?
Yeah, exactly. Well, hopefully it will be flying again very soon. And Ishrat Ullah, how has the pandemic changed the way you operate at the Qatar charity? Mr. Ullah, if you could just put your microphone on, please. Thank you.
Yes, sorry. I was saying that definitely the pandemic has affected all, aspects of NGOs work, from running programs, planning, financing, and everything. Being from Qatar charity point of view, during the pandemic, monitoring and evaluations of the programs were somehow difficult. But what we have tried to during this challenging time, during the pandemic, we have supported like almost 60 countries across the globe by like investing $24 million by providing them like hygiene kits, personal protection material like masks, like sanitizer and these things. So we have been trying to, to avoid stopping the work or to cater the needs of the affected people. We have been trying to, and so far we have assisted 60 countries across the globe during this pandemic time.
Very interesting. Thank you. Over 60 countries. Wow. And for you, Bashar Alali, the same question then at the Qatar Fund for Development. How has COVID-19 impacted the way you view applications for funding and support? You suggested earlier that it was very much trying to reach the most needy and prioritize them. And how are the programs you currently fund, how have they had to adapt?
Yes, so with COVID, the world and especially development international actors were forced to pivot and reprioritize. So the development landscape itself has become virtually unrecognizable. And this full socioeconomic impact is yet fully to be absorbed and assessed. That being said, in the fund, we understand and we recognize that addressing systemic and addressing system vulnerabilities is what has made the biggest difference. So in projects like ESPN, the Expanded Special Project for Elimination of Neglected Tropical Diseases, and Qatar Creating Vision with Orbis, those are projects that we've witnessed where training and awareness raising, building capacity within the community and community awareness, creating wash facilities have helped as well in COVID mitigation efforts. So our priority following that has become is now focused on first relief as a first step, emergency response to save lives, and then that was followed by a restructuring or a structuring phase where the focus is on identifying and addressing gaps in existing policy frameworks and existing systems and structures on all levels, micro, meso, and macro, and then improve services to address these gaps. And then the final step or the phase is through resilient recovery. So we look at ways where we could build back better, and we build back better and stronger systems. So this has been the fund's approach and its adaptation through these trying times.
So having to pivot very quickly indeed. I wanted to ask you all, in your experience, how much of an issue is the shortage of healthcare workers? Is there a huge shortage? And with COVID-19, that must have impacted that element as well. Mr. Ahmad.
There was a shortage because initially we received a very big caseload in our hospital, and basically the basic problem was that there was few experts on this. This was new for everybody, and even the health provider, they didn't know how to respond to this situation initially. So there was a huge load on the. There was a lack of equipment, suppose ventilator and the rest of the stuff required for such type of response. And it was a big problem how to transport that from abroad. So that was another issue. So it took time. There was a misperception and misinformation and disinformation dilemma in the start as well. That few of the health workers, they stopped coming to the hospitals as well. Only the emergency wards were open and the OPD was open, but the rest of the health responder, they stopped attending clinics, if I can say it, for private sector. So there was a fear, there was a lack of understanding of the infection. So yes, initially we faced this situation, not only of the health care provider, but of the equipment required for such type of response, as such ventilator. I can say. Thank you.
And how much of an issue is the shortage of healthcare workers generally, even pre-COVID? Because one would assume that will really impact the effectiveness of really securing localized healthcare services. And that's why it's so important that people are trained, as you do at Orbis, for example, Dr. Walters.
Absolutely. No, there is a universal shortage of healthcare workers and healthcare skills in all of the developing countries we work, for the reasons I've explained earlier on, because these countries are underfunded. There are educational issues often for the obvious reasons, and they also have an enormous burden of disease, so that they are hit on both sides of it. So COVID-19 has made that worse. I mean, clearly, many healthcare workers have had to be diverted into the emergency treatment of COVID patients. And indeed, I was volunteering myself in this country to work in it. So it does take you away from your principal objectives. But nevertheless, I think that it has also brought people together. COVID has brought people together and has enabled us to see that through all these difficulties, there is a way through, and it will work out. And actually, we will end up strengthened in the end. But yes, it is a problem universally.
Thank you, Dr. Walters. And Orbis has some great partnerships I've seen. How important also is charitable giving to the long-term sustainability of all of your projects? And if we pick up with you then, Dr. Walters, briefly, how important is that charitable giving? It's
fundamental to what we do, and our partners like Qatar Fund for Development and Qatar Charity, without the contributions they make, which are huge, then we simply wouldn't be able to do the work we do. And interestingly, during COVID-19, we as an organisation have found that there has been an increase in support for the work we do, but undoubtedly, without those funds, you simply can't do the work you want to do. Equally, we try to work on the basis of matching funds if we can. So we try to engage with governments, for example, to say that if we can raise a certain amount of money amongst our individual donors, for example, will they match it? And that can be a very powerful way of raising funds.
Thank you. And what about in Pakistan then for you, Mr. Ahmad? How important is that charitable giving to the long-term sustainability of the projects that you are trying to see through there?
Very important. In this very situation right now, it was like a firefighting. So for that purpose, we raised like the global humanitarian appeal in some funding from like Qatar Charity and Qatar Development Fund, bilateral funding as well to Pakistan. Now what we are doing, that simultaneously now we are developing a nexus between humanitarian response to our development, to the development level, so that we can invest this funding for the emergency response in a way that our institution gets strengthened and developed and for a sustainable development in Pakistan. Over.
Thank you. Okay, thank you so much. We now have a few minutes just to take an audience question or two. So thank you for now for your answers, and now we will go to the audience questions. So the first question I have is from Isabel Miner, and she says, in low and middle income countries, sometimes the problem is not about lack of requisite resources, but about the inefficient use of the available resources and or setting the wrong priorities. How are your respective organizations helping such local communities to set the right priorities and be more efficient for more sustainability? Otherwise, she says, the fish is not always sustainable, but rather the fishing rod. Who would like to answer that briefly first, please? Because we only have a few minutes left. Yes, please.
I can talk about it a little if you wish. In that developing healthcare systems in developing countries is vital, because that is the basic structure you require to work efficiently. And so I think all NGOs try to work very carefully within the system that's available at the time. So you need to work with the government, to work within their healthcare systems, and to try to strengthen those and change those. And not only do you need to educate the healthcare workers, but you also need to educate and work very closely with the administrators, not forgetting that we can learn just as much from them as they can learn from us. So it's a great deal of mutuality involved in this.
Thank you, Dr. Walters. And Mr. Ahmad, you wanted to say something on that?
Yeah, I'm in total agreement with the lady. Governance is a big issue in the third world countries or in the developing countries, and the solution is how to make the government and the rest of the stakeholder accountable to the community, so that they can set the priorities right. This is the answer.
I would like to add one thing, like the community awareness and community advocacy is more important, because the community can pressurize the local government or the government in the country to strengthen the health system and the health services, to provide the efficient health services to the local communities. So their awareness is more important as well.
Thank you very much. Bashaya, any word on that quickly before we close?
Yeah, just quickly to add to that, I think it is important to work with local governments in relation to international global agendas and health priorities. So if we look at the WHO listed 13 goals, for example, if we look at the declaration program, the Istanbul Declaration for least developed countries, those are some of the international reference frameworks that we could use to kind of create synergies between what is needed locally and what needs to be addressed globally.
Thank you so much to all of you. We are going to have to bring it to a close, but really interesting to hear from you the importance of collaboration at all levels, the importance of innovation, especially when it comes to funding, if we're really going to be able to create local solutions for local needs. So just to thank all of my panel, Dr. Robert Walters, Ishrat Ullah, Mohammed Ahmad, and Bashaya Al-Ali. And thank you very much from me, Louisa Baldini, and I will be here each day this week with an InFocus session at the same time. Hope to see you tomorrow.
Thank you.